Welcome to Power Up Recovery with Nutrition. It is time to make nutrition part of the conversation. I'm your host, Christina Veselak, and I'm so glad you're here. Did you know that it's our brain's job to allow us to cope with stress gracefully? But to do that, it needs to be fed optimally. Have you ever wondered why so many committed people relapse or maybe even die? Why so many people on psychotropic medication still feel lousy and still have cravings? What if the missing piece is food, the right food? What if the right nutrients like amino acids or even eating protein every 4 hours could actually balance your brain chemistry and your mood without medication and support lasting recovery? In this podcast, we explore the powerful connection between feeding your brain well, mental health, relapse, and recovery from addiction. We will share insights from experts, inspiring recovery stories, and practical strategies you can use today. Whether you're in recovery, a healthcare professional, or someone passionate about emotional well being, this show is for you. Let's dive in and discover how fueling your body and brain with the right food, the right amino acids, and other key nutrients can fuel your transformation today. Welcome. Hi, everyone. Welcome to the next episode of Power Up Recovery with Nutrition, covering anything that has to do with feeding the brain what it needs to function optimally so that we can function optimally in our lives. Today, I am happy to introduce and chat with Dr. Mikala Reznik, who has been a longtime student of mine and a wonderful friend and a brilliant practitioner. She actually combines amino acid therapy with neurofeedback. So, Mikey, tell us
Mhm.
about you.
So thank you so much, Christina. I'm really pleased to have the opportunity to visit with you today and share the wonderful world of neurofeedback combined with amino acid therapy. And here at Resnick Focus Center, we have fully embraced how we can naturally build our body back to be able to have hope without side effects. And
Mhm.
we offer natural solutions for modern problems. And so using the neurofeedback has been a long-term flagship service here at Resnick Focus Center. And then adding amino acid therapy has been the perfect combination. And so what happens is that the client is able to come into the focus center for the neurofeedback, and then they're able to take with them outside of the center the support with the amino acid therapy. And so it's really a holistic, fully embraced approach where we partner with our clients. And so they
Mm.
the effort to come in, but we also empower them whenever they're outside of the center. And so, and of course, we're able to support them by text, phone call, email also. But there's just nothing like being able to have this, in clinic and out of clinic support. So with the
Sure.
type of neurofeedback that we're able to offer to those clients that are local, and even clients that are not local that are able to travel in and see us even once a month. And so that's a little bit about what we do here at the practice. And I myself am a doctor of physical therapy, and I've been licensed to practice physical therapy since 2002. And so
Oh.
during that time, I spent basically my first 10 years in the clinic in several different settings. So outpatient, hospital-based, home health, and independent living for seniors, assisted living for seniors, and pediatrics. And
Mm-hmm.
my second decade of licensed practice was in higher education. So I was able to serve as program director for a physical therapist assistant program at a community college, and then also as a professor at the university level for doctor of physical therapy program, where I was part of the clinical education team in addition to foundational skills and
Mm.
pediatrics.
Nice.
And so that was my second decade. And so here in my third decade, I'm really excited to be in private practice. And, I really see how my previous 20 plus years of clinical experience led me to be ready to do what I do now. It's really what I was meant to do. But I wouldn't have been as efficient, proficient, and happy about providing it without the life steps that I had to go through to be ready. It's
Well, I
amazing.
really love your idea of partnering with your clients and with your patients,
Thank you.
because I don't think enough people believe in that. It's like, we're
Right.
the expert up here and we're telling you what to do and we're going to fix you and you just be good little boys and girls and do what we tell you to do.
I think that worked, maybe 15, 20 years ago, but now that our clients are more informed of a lot of options, and then also they are looking to, and kind of unfortunately to, Dr. Google, who does not know them,
That's true. No.
and actually contributes to more stress, which then contributes to worsening of issues. And so I'm working with clients who are better informed does have a lot of benefits, because we have clients seeking us out specifically for neurofeedback because they have done some research and found on the internet. So in that way, Dr. Google is serving them well to point them in the right direction for some practitioners that are doing more holistic options.
Yes.
At the same time, Dr. Google is not a personal, support for their
No.
condition. And so,
And I think you bring up a really good point, especially when we talk about amino acid therapy, because there's a lot of information out there about amino acid therapy. There are books and there are articles and there are Amazon shops and all sorts of things. And it can get really overwhelming and confusing to people
absolutely.
to find their way through.
Mm-hmm.
I mean, on the one hand, amino acid therapy is really straightforward, it's really science-based,
Yes.
and it's really direct.
Mm-hmm.
On the other hand, there's a little bit of an art to the science,
Mm-hmm.
and part of the art really has to do with the fact that we're all bio-individuals.
Yes, I love that phrase. Mm-hmm.
We have genetic differences, we have lifestyle differences, we have how well we've been feeding ourselves or not feeding ourselves over a long period of time differences.
Yes.
And all of this adds up to one size simply does not fit all. And I've had, people call me and saying, well, I read the book and the book said this and it just didn't work for me the way it was supposed to.
Mm-hmm. Right.
I said, yeah, that happens sometimes. Why don't you make an appointment, come in, and we'll sort it out?
I like that. Mm-hmm.
Right. And that's why I started my academy to teach other practitioners how to become expert at amino acid therapy so people can get the informed support
Mm-hmm.
that they need.
Right, right. And that informed support is so important because there's all this information out there, just like you mentioned, and the World Wide Web is full of information, but it doesn't become knowledge until that information is applicable and
That's
applying
right.
to the individual with all of these differences, all of the variety of life experiences that individual brings to where they are at that moment, and the challenges and the gifts that they have, I mean, whether they've persevered and been able to really restore some resiliency, or whether their resiliency is just sabotaged and overused. And, where is that individual? And that's where a provider who has gone through the training and how amino acid completely revolutionized my practice is just awesome, because I love how we can continue to use the body and how the body and that individual is working. We all have a basic biology about us. And so,
Sure.
and we can use that foundational biology knowledge to be able to apply to the individual. And then us as caring practitioners who are actually taking time with our
There
clients. Wow.
is.
Imagine that is back. you know?
Taking time and asking questions, the right
Yes.
questions.
The right questions. Yes, absolutely. And that's one thing that I just loved about going through your academy is that it really fine-tuned what I needed to be looking at. So
Hmm.
because my training as a physical therapist, and then whenever I was on the professor level, training the next generation of physical therapists and physical therapist assistants, we're already trained to think a certain way. We're thinking about the entire body. We're not only thinking about the shoulder, we're thinking about the neck, the rib cage and everything. But as neurofeedback therapist, I'm also thinking about the brain and how it connects neurologically. And then now with the amino acid, the specific amino acid targeted therapy, just giving the body what it needs to be able to perform all these beautiful systems and processes that are naturally occurring. It's just works great as a physical therapist because I've already been thinking holistically, the
Uh-huh.
whole body, but now I'm just thinking even a more detailed level, which I was
Right.
excited
Right.
about thinking, the brain waves and how the brain connects to the body, but now this biology piece, it's just so cool how it just all works together.
So how has the amino acid therapy sort of upped your practice? How do you integrate it in? And do you have any stories about kind of the difference that it's making?
Absolutely. We see families here at Resnick Focus Center, and usually that starts with one individual. The entire family doesn't make an appointment, come in at once. That would be too
Okay.
much. But starting, oftentimes with a child
Uh-huh.
that is having trouble in school. Of course, this is a post-COVID world. And so our children, in my opinion, that I've seen clinically, and also I am a parent, so I've had that personal experience as well. Our children had a different experience, going through and past COVID than we as adults did. And so they didn't have as many years to establish their coping patterns and strategies that we as adults did. And so whenever our children are now back into basically a pre-COVID world, and the expectations are for them to be the same as they were
Hmm.
before, which is, kind of a topic for a different podcast probably.
Yeah. Yeah.
And so, but, these children, and especially I have seen in my practice, boys in preschool all the way up to high school that are just really struggling, with the stress of life,
Mm.
getting up and going to school and getting through the school day. That's all that they can do. And maybe they can't even do that. So whenever we first have the conversation, we're talking about, okay, what are we eating for breakfast? And families aren't necessarily prepared for that question because
No.
there's not a big pharma budget out there in the natural world, the natural health world, to say, hey, these kids especially need to have some protein in their body, especially if we're
Hmm.
going to expect them to go sit still, which their bodies are not made to do. And then, oh, we want them to learn on top of that. What? And so these are just not natural functions that especially, boys are made to do genetically. And so if we can feed them, so we're not going to change society. Okay. So we have to work within the realm of what our society rules are. And right now that says whenever you're about age 5 to about age 18 or so, you're going to be in school. And then the premise is please learn something while you're there. So, but if we can start the day off with, okay, let's feed the brain and feed the body with some protein, and then at least get through the first couple of hours of school. I also will.
Fills everything out, doesn't it?
Absolutely, absolutely. So that's usually an early question that we start with. And so I also, advocate the family preparing the kid with some protein snacks so that they can have one midday, or I'm sorry, mid-morning,
Hmm.
and then augment their lunch with some extra protein. Because a lot of times families are relying on the school district to pay or to provide the breakfast, but they don't know what their child is eating for breakfast or lunch. And we all know that protein is more expensive than the junk carbs out there. So guess what the school district with their limited budget is probably going to default to, unless we know specifically that that's not happening.
Right.
And so,
Right.
but if we can at least feed our children with some protein, and then sure, if they need to eat breakfast at school and get that extra, okay, I don't have a problem with that. But let's feed them protein first, and let's feed them at the house, whenever we have some influence over what that protein is going to be. And so, and it's very culturally a norm here in the US to have breakfast as eggs. And so now if eggs are not going to be agreeable, then we have that other next step conversation. But usually eggs are a great way to start the day. If one egg has, approximately 7 grams of protein, just even one egg is giving our kids a great start.
That's right.
Mm-hmm.
And there's so many other options as well that
So
can
many.
be really easy for
Absolutely.
parents. And in fact, for those of you out there wondering, well, what can I feed my kids? I have a nonprofit called Eating Protein Saves Lives that has lots of protein breakfast and
Mm-hmm.
snack and dinner ideas on it.
Mm-hmm. Yes, yes. And, we also promote a plant-based protein for meal replacement or nutritional meals, which are a great option. And, but it has to be good, clean protein. CNN came out with an article probably about 5 weeks ago now, talking about how several over-the-counter or off-the-shelf proteins have high amount of heavy metals in it. Arsenic, lead, cadmium. And in the wellness space, we've known this for a while, but it was really validating, if you will, for a major outlet to publish something to say, hey, this stuff is,
That's
not great for you. And so going to finding a high quality, non-poisonous, protein, you wouldn't think that in a first world country such as the US that we would be having to have this conversation, but we do. And so a healthcare practice such as ours that has a nutrition line, and we have more than one line that we carry, but we're going to be a good source to help have those conversations, because we've done the research. We know that we're only going to carry high quality products. But I also advocate clients going to their neighborhood health food store, a small batch health food store that is like ours. We get a shipment pretty much every week, so our product rotates. The grocery store is not there for our individual health. They're bringing in foods that will, number one, sell, and we don't know how long those nutritional supplements have been on the shelf. How are they transported? Did they stay out in the heat too long? Did they stay out in the cold too long? And how long ago did they leave the manufacturing facility? And so that's just not a great place for a high quality supplement that the body's going to actually need, on the bioavailability side of being a bio individual.
right. Absolutely. So where actually are you located?
So we are in Odessa, Texas, and that is halfway between Dallas and El Paso. And so north of Big Bend area. And so we're kind of this oasis in the medical desert, if you will. A lot of our clients do seek services in Lubbock, which is 120 miles north of us, or in the Dallas-Fort Worth area, which is a good 5 hours east of where we are. And I can get to Houston 8 hours by car or 1 hour by flight, and it's all in Texas. So
this is one of those really big states.
It is. It's a wonderful state. I love serving our community and our state, our practice, and being an advocate for other practitioners to start using their problem solving skills and really have their powers of observation intact to say, okay, I was doing by the book stuff for a while. I really learned well and paid a lot of tuition, took a lot of tests to know what I did, know how I was to practice traditionally. And then at some point, what we were trained to do and what I had to teach, there was so much more than that. And so ethically, I was conflicted, and it led me to the wellness space. And so because at some point, whenever you see what's supposed to be working is not working, you have to keep thinking and really looking at the information, at the facts that are presented to one, and find those solutions. And that led me to the wellness space. And it also led me to amino acid therapy.
So do you have any stories that you can share with us?
Sure. And so I'll kind of stick with the same story, young men who is in our area. We are big into football. And so I know it's all over the US, but here in Odessa, Texas, with Odessa Permian, Mojo, I went through Permian High School. It was great. And it's gotten very even more so integrated into our young boys who are playing contact sports very early now, full contact sports very early, and head injury. And so we do see kids that maybe were doing fine, and then all of a sudden, headaches and unable to concentrate, and the social connections change, the academic grades definitely started to suffer. And how can we support these kids? We usually see a lot of children and teens after they've been through continuous disappointment in the traditional healthcare system and conventional medicine, Western medicine. And so by the time they land here with us, they may not even be that hopeful. They're just trying to mark off the list. Well, we tried something else, and all the other stuff hasn't worked. So we're going to try this too, but we're really not hopeful. But we're going to do it just because we are seeking options. And it's sad that the families and the child are there in that situation, but we meet them where they are. And so in being able to do that, we have the conversation on what are we eating and how often are we eating protein, and even eating protein at night. And I really love that pearl I picked up from you in one of your classes is, eating just 5 grams of protein at night, brush your teeth, go to bed, and see how the sleep goes. And because we're looking at blood sugar, what is happening at night? Are we running out of blood sugar? Our blood sugar dips, so our body sends in adrenaline. We wake up, and all we can do is stay awake and have our mind spinning. But having that little protein trial at night and see if is 5 grams enough. Okay, maybe I need 10, maybe I need 15, maybe I need 20, but we're trending in the right direction to be able to stay asleep longer and have a better quality of sleep. And so, and whenever we're making.
So Mikey, have you added like fish oil to your work with the neurofeedback with brain injury?
Yes,
And how has
absolutely.
it made a difference?
So it takes several days before we see a difference. Okay, so I make sure that the family knows this isn't like taking Tylenol that you have an effect, in a short amount of time. And it's not.
Unlike amino acids.
I was just
That do
about to
work
say,
within
just
20
like
minutes.
yeah,
Yeah.
yeah, because we do see a quick, turnaround with amino acids, but the omegas, it's just like brushing your teeth. It's one of those things we're going to need to do long term. Period. The dental industry has done a great job teaching us that, we go in at least twice a year still. If we have 0 problems, we're still going in for our teeth cleaning. And so omegas fit into that category. It's going to be a longer term thing, just like our vitamin Bs, just like our protein, thinking I really need to put this in my lifestyle. And so that I can do the omegas. But yes, there seems to be, and there is this anti-inflammatory from the inside out effect. Once we're able to dose it high enough and long enough so that the gut can tolerate it, meaning that they don't have an upset stomach, okay? But at the same time, that those omegas are definitely needed for the healing of the brain so it can make those connections. I talk about it like it's where the brain is kind of oiled enough on the inside that those nerves can heal.
Yeah.
So, and with a high quality fish oil, there shouldn't be that burping it up. Also, do we have enough digestive enzymes? The fish oil can be stored in the fridge, and so it makes it easier to take. And if it's a capsule, it can actually be stored in the freezer so that by the time we take the omega capsule and it gets deep enough into our digestion that it starts to dissolve, we're not going to have those burps. And so, because that's the main concern is having that fishy burp. Nobody wants that.
That's true. And so have you found that bringing in the omega-3 fatty acids for brain injury has helped the neurofeedback work faster?
Yes, it does seem to work faster, and the response is longer lasting. And so
Ah,
with the neurofeedback, I see my clients, they sign a social contract with me saying that they understand once they start, they need to get the first 4 sessions within 14 days at a minimum. I will see
mhm.
clients also daily. I have clients that travel in from out of town several hours. I'll see them twice a day. And if they're able to spend the night, I'll see them again the next day, maybe just once the next day for neurofeedback. But we're having these conversations on amino acids, we're having these conversations on omegas, and they're people are just not understanding how important this nutrition is to help their body work the way it was working at some point. And
Mhm,
so,
mhm.
so really we're just restoring the savings account of the body that's been depleted over time,
That's
and
right.
stress really makes us burn through our nutrients faster. And that's why we need to eat more often. We need to eat something high quality more often, but it is okay to eat. It is okay. Fasting is huge and it has its time and place. But in my practice, my recommendation is after you are good for 3 months on your mood, you're not having false low moods, and you're in a good place after 3 months, then if you want to go to fasting, then let's have that conversation on what that can look like, saving your benefits, because the people you're connected to need you to stay good.
Yeah,
And if you're not
yeah.
going to do it for yourself, at least do it for your loved ones, because your family members, your household, they don't deserve that you are going to be fasting and acting like a jerk. And so, because that's what happens a lot of times.
Yeah, it sure does. We can
Mhm.
come back around to that, but got a question about sort of anxiety and stress, because I know a lot of people use neurofeedback to sleep better, to relax,
Mhm.
to reduce anxiety and panic. And
Absolutely.
so I'm curious about what amino acids you use along with the neurofeedback to help people relax and stop being panicky and sleep better.
Yes. So I love the amino acid chart, and we use that in the practice regularly. And so if a
So that's
client,
an assessment tool. By the way,
yeah,
everyone, that's an assessment tool that we use that was developed by Julia Ross to identify specific neurotransmitter system depletions so that we know exactly where to come in with the amino acids.
absolutely. And if I had to guess, instead of have somebody complete the amino acid chart, I do, I love 5-HTP. I love GABA. I love theanine. And but the amino acid chart is going to really hone in so that we hit that high likelihood in amino
Right.
acid early. And so,
Yeah.
and
And
a
you're
lot,
right the first time.
yes, yes. And so that's really much more efficient for our clients' time and resources. And they're getting into their benefits so much faster. And
Yeah.
so, and many people have tried GABA and theanine and 5-HTP, tryptophan, and less tyrosine. Tyrosine isn't really out there, but I love tyrosine. And so it ends up that if they've tried, oh, I've already tried this and, didn't have great results, then I'm asking, okay, where did you source that from? Where
Mhm.
did you get it from? And a lot of
Yeah.
times it's Amazon, and Amazon is fine as long as you're getting it from the Amazon store of the manufacturer and not just some random provider or seller, so but we're just hitting that click now or buy now button and put it in the cart. We're not really looking at that level of detail,
Right.
and then
But we
definitely the
need to
grocery
be.
store. Yeah, we need to be.
Yes,
So it's part of the
source
education.
matters. But dose matters as well. And a lot of people,
Mhm.
take a very low dose and
Yes,
it doesn't do anything. And they're afraid to go higher because that's what it says on the bottle.
right,
And so they then just throw the bottle away because it's not doing them any good.
right, exactly. So whenever we use the amino acid chart and it has guidelines on a range of milligrams, but that's still relatively low. And so whenever we have the conversation of really a supplement such as an amino acid is a conveniently packaged food.
Yes, purified food.
Correct. Yes. And then it's not a prescription. So we can go so much higher
That's
for
right.
whatever the needs are. And this is not part of the long term. lifestyle of omegas and Bs.
Mm.
Our amino acids, and I love this idea of once we're able to help the body prime the pump, if you will, with making the amino acids, that it's made to make the amino acids naturally whenever it has all the resources to be able to do that with our diet and with less stress and better sleep but if we're able to at least prime the pump in the way that the body remembers, or it's reminded, hey, I'm supposed to be making this. And so eventually we have to take less amino acids over time. It's awesome. That
It's
is
very cool because the
Mhm.
brain is using the protein we eat along with the rest of the food to
Mhm.
rebuild its neurotransmitter stores so that over time we get to take less and less of the amino acid rather
Mhm.
than more and more like all those prescription drugs out there or
Mhm.
street drugs out there that people will use to find relief. And they
Yes.
work within 20 minutes.
Yes. I mean, it's just amazing. It's just amazing. And that's where the amino acid therapy has made such a difference in my personal life, in my household, and in my extended family. And I just love how I can, be talking to somebody that is not in Odessa, Texas proper, but I can make recommendations of something they can source it themselves locally at a local health food store or a healthcare practice that carries nutrition, and they're feeling better within a couple of days. Because even prescriptions, whenever we're talking emotional health prescriptions or emotional altering subscriptions, are not going to work as quickly as the amino acids.
That's right.
Mm-hmm.
Now, a lot of people go to neurofeedback for pain relief, generally of chronic pain, occasionally acute pain, but definitely for chronic pain where it's sort of gotten established in the brain waves. How do
Yes.
you use amino acids for chronic pain with your neurofeedback clients?
Yes, love this question. So, as a physical therapist using neurofeedback, I'm very comfortable using neurofeedback on the body. Okay.
Mm,
So, I can bracket a joint, I can be working, some vagus nerve work. And so, not every neurofeedback provider is going to be comfortable using their brand of neurofeedback on the body. So, but
right.
my practice, we do. And so, there's lots of ways to figure out what is the pain generator. It's not always the joint where the pain is.
Mm,
So, that's some of the differential diagnosis that we go through. Just because it didn't help at the shoulder doesn't mean that there's not something else somewhere that we can be impacting with neurofeedback because of the pain signals and the pain patterns that have been established, especially if it's been long term. And there's usually a stress component with that. And so looking at using amino acids for pain relief and to help with stress with coping, those are two different pathways that we can use amino acids for.
different thing. So,
Mm-hmm.
what amino acid is your favorite one for just straight pain relief?
DPA.
DPA. Can you
DPA.
tell us about DPA or diphenylalanine?
Yes. Thank you for pronouncing the whole word. I was not going to try that.
I've
So
had lots of practice.
good. Yes. Yes. Good. So DPA, as I prefer to call it, as the little abbreviation, is a wonderful, wonderful addition to amino acid practice. And it's also great for broken heart syndrome, if you will.
Mm,
And
yeah,
so a lot of times there's a stress event coupled with the pain. And so
that's right.
was that trauma? Was it physical trauma? Was it emotional or relationship trauma? You know, um, but DPA is definitely my favorite for pain because there is an interlinking of stress with physical pain. And DPA
That's right.
can address both of those conditions. And since these are clean food products, we can also dose it differently as we need to throughout the day. And so
That's
for
right.
example, somebody who is especially lonely in the afternoon or evening, because that's whenever there's just, there's no work. Everybody's kind of busy after you have dinner and you have to get your own household ready. So there's less connections with others. And so if they've lost a spouse, for example, then those evenings could be very, very sad, lonely times. And then our coping mechanisms can change during those times. And so
That's right.
we might choose,
But like eating your gallon of ice cream.
yes, we might choose foods for comfort. Yes. And they're like, oh my gosh, how did I just eat that whole thing? I thought I was just going to have, 2 spoonfuls or something. But
That's right.
I recommend,
But some people are going to overexercise and
yes,
actually
do that.
harm themselves more, do more physical
Absolutely.
damage.
Absolutely.
Mhm.
And that's where it's difficult because exercise really is one of the most underused modalities for well-being and having a good mood naturally. But we can't overdo any of a good thing can be overdone. So
Yeah. Yeah.
yes. But I urge my clients, I have one sweet lady. She's been with me at the Focus Center since before I even had, the suite that I'm in. And so that's over 3 years. And she had lost a spouse suddenly, and she was very, very connected with her spouse. And so it's different than two people who are existing together, but they were very, very, emotionally, intellectually, physically connected in their day. And so losing him suddenly just sent her into a spin. And so her evenings were the most difficult. And so if she could have just enough self-control, just 5 seconds, to grab that DPA, open it under her tongue, swish with her water so that it would get into her system much faster, and then follow it up with an oral one that she took. She would swallow the pill. So she was on 2, but the first one under the tongue, so to quickly get in the system. Then she didn't eat so many corn dogs at night because
That's
that
funny.
was her comfort food,
Uh-huh.
and
Uh-huh.
so if she just had a little bit, and after eating all of that processed food, she didn't feel good, but yet
No.
she was so compelled to eat corn dogs. And so that was her specific thing, but she needed that support during the evening. And so the DPA is something that she continues to utilize, and that's a sustainable coping mechanism. And so I really have tried to avoid healthy, unhealthy, good, bad. There's stigmas related to that. So let's talk about having a sustainable coping strategy so that she can still have some quality of life. She can still have a corn dog if she wants a corn dog. I'm not saying restriction. I'm not saying no. I'm saying let's give our system a little support so that once you eat half that corn dog or the one corn dog, you're good. You don't need 5.
That's right. And you can enjoy your one corn dog.
Absolutely. Please enjoy. Please enjoy.
Yeah. Yeah.
And there's many
So,
worse things than corn dogs to choose also.
so as you know, a few weeks ago, I very badly injured my knee and wasn't walking for a while. And at night, especially while sleeping, it was really painful. And turning over was painful, and moving was painful, and it was all painful. And at first, I forgot that I had this bottle of in the cupboard. And then, though, I should know this, right? But we forget things. And all of a sudden, it was, oh yeah. And so I pulled it out and I took, I think, 4, which is 2 grams, which is a good solid dose.
Mhm.
And I slept so much better that night because it just took the edge off the pain.
Mhm.
And so I kept taking it, and it really made a huge difference while my leg was healing, so that I didn't need to, for instance, go on an opioid. The
Mhm.
doctor gave me an opioid, and I looked at it and I said, I don't think so. Having worked with way too many people who've gotten addicted to their, pain medication. But this supports endorphin activity in the brain and is anti-addictive, is
Mhm.
non-addictive, is safe. It doesn't it's not going to like completely numb you out so you're not feeling anything. But it so beautifully took the edge off the pain. And so many people, I mean, my physical therapist didn't know about it, my doctor didn't know about it. But I was so grateful that I had that knowledge to help myself with it while I healed.
Mhm. Absolutely. Yeah, the physical benefits, and then the emotional benefits, because whenever we are in pain, we don't know how long it's going to last.
No, we don't.
And there's a
I
huge
was scared that it
Hmm.
was going to last like forever.
Right. So, and I have to be careful too. I've seen how chronic pain has debilitated individuals and destroyed relationships. And so that's something that anytime I have pain, and my trainer teases me because he's like, Mikala, don't overanalyze this. If I have poor form and he has to correct me and I have a little
Mhm.
pain, but it's a real trigger for me just because of my industry. I've seen how chronic pain, and we never know whenever pain is going to stay acute and it's only going to last a little bit, or if the system is going to switch into, oh, this little ankle roll now becomes, detrimental long term, because I've just seen it so many times. But that's before I knew neurofeedback and before I knew amino acid therapy. So using the two together has been, another great thing for clients to be able to have those options, being able to support their system with the amino acid therapy so that they're not under stress whenever they leave the practice, and then they come in for their neurofeedback, and I can get them to their goals with fewer feedback sessions, which means a lower cost to them.
Right.
And the amino acids are not even expensive. Whenever I point out, because we do sampling, we have a sample bar here in the practice. And so I can sample here whenever they're with us physically. And
Uh-huh.
they're like, what is this in my head? Is this really better already? Like,
Yeah.
sure,
Yeah.
trust your intuition. You were given intuition, and we've been trained to not trust it, but please start being open to it. And yes,
That's,
it's good that you're seeing a difference. And yes, it really is true.
it's real. It
It
really
really
is
is.
real.
Mhm.
Really can work that fast. Well,
Right.
this has been a wonderful conversation.
Thank you. I've been enjoying it very much. Love it.
And you're going to be speaking at our upcoming Friends Feed the Recovering Brain,
I am.
April 30th through May 2nd, 2025.
Yes.
Can you just share with us a tiny little synopsis of what you're going to be talking about?
Yes. So I'm going to be sharing one of my cases, one of my clients that trusted her health to the focus center, and she was working through food addiction. And so I'm going to be sharing how neurofeedback and amino acid was able to support her on her journey toward recovery. And the interesting thing about food addiction is it's something that we can't just say, oh, I'm just not going to eat.
No,
That's really not an option. And
no.
so having to balance, how do I know how much is enough? How much do I know how much is too much whenever, we're coming from this being a truly a challenge. And so that's the case I'm going to be sharing.
Oh, I'm looking forward to hearing it. Thank you so much.
Yeah, thank you. Thank you for the
Anything
opportunity.
final you would like to share with us before we stop for the day?
So I'm a big protein, proponent. And so please just, consider the basics. Your macros are so important. There's lots of great information on macros, but really protein, and getting an individual's muscle mass number becomes the grams of protein for the day to aim for. And so here at Resnick Focus Center, we do have an infrared body scanner that tells us many things, but my favorite thing is the muscle mass number. And so an individual is able to really know what is their particular number. And once again, it's not based on Dr. Google. And so I
Right.
think that
Excellent.
needs to be standard, that individuals can go at least once a year, get their muscle mass number. My clients, I recommend every 3 months or anytime they're making a change, especially with their diet, because muscle mass is so difficult to gain. And so, for example, it took me all year last year working with the trainer to gain 7 pounds of muscle. I worked
Oh my.
very diligently on that on purpose to increase my muscle mass. And it took me a year to just gain 7 pounds. But knowing that muscle mass number is empowering, and we need to make sure we add to our muscle mass and definitely don't lose it. And protein is a way for that. So not only for physical well-being, but also emotional well-being. And it's just awesome because everybody goes to the grocery store, might as well be getting something healthy and good for you. So keep your moods and your relationships on the up and up.
There you go. Well, thank you very much. And I look forward to seeing you at the conference. Thank you all for tuning in to this episode of Power Up Recovery with Nutrition. I hope you've learned something. Please share this with other people and please push the like button and come back again. Thank you for tuning in to Power Up Recovery with Nutrition. I'm Christina Veselak, your host, and I hope today's episode has inspired and equipped you with new insights and tools to support your recovery journey or practice. If you enjoyed this episode, please subscribe, leave a review, and share it with others who could benefit from the knowledge shared here. Stay connected with us for more episodes filled with practical advice, expert wisdom, and inspiring recovery stories. Remember, nutrition is a powerful tool in mental health and relapse prevention. Power up your recovery today. I'm Christina Veselak, and I'll see you next time.